So what is interventional radiology? It is basically taking two different specialties, like radiology, which everybody knows is the study of being able to read x-rays or CAT scans or MRIs, and understanding what are those tests really intended for, using those tests and those machines to be able to do certain types of minimally invasive procedures. Everybody knows about an angiogram. A cardiologist does an angiogram for the heart. Well, there's other blood vessels that get diseased in the body. Who takes care of these disorders? Well, it's an interventional radiologist. We can fix problems all the way from the head all the way down to your toes. In general, we do a lot of patients who have back pain and leg pain. Traditionally, these are patients who haven't had much luck in finding somebody who's going to be able to help them. Here's what we would be able to do is at least describe what we think is going on with you and potentially talk to your primary care doctor and come up with a game plan. Sometimes I tell my patients, all you need is another quarterback sometimes, from a different point of view. There's MRI, there's ultrasound, there's CAT scan, there's nuclear imaging studies, PET scans, and this is our area of expertise. We know exactly what types of studies are good for what types of things, and we, as an interventional radiologist, we could take it a step further and offer sometimes a diagnostic solution and sometimes a therapeutic solution. We're one of the few practices in the country that have dedicated themselves solely just to doing these types of procedures. In the last 4 or 5 years, we've created a pretty robust practice here in the Dayton area with offices in Springfield and Troy. We have a large clinical practice here at one of our local hospitals. We find our biggest challenge is usually just in explaining to a patient what their options may be when it comes to treatment. And many of our patients are skeptical because they've been told for years and years that nothing can be done for their pain. We get a lot of chronic pain patients. We get patients who have been told, well, the only option here is going to be surgery for you. And it takes a little explaining to do to be able to get them to understand that, there may be some options. If you're the type of patient who is out there and is wondering, could there be something else that could be done for my condition? Maybe you have chronic pain, maybe you have a fibroid problem, or just a general medical problem, and you're wondering, maybe is there something else that could be done? We would be the type of practice that you could come to and maybe get some answers.